The majority of people who spoke here in Frankfort today were opposed to any changes that would lessen their access to Medicaid.
It would put Kentuckians' health care coverage at risk.
Debbie McAfee has multiple sclerosis and was among those who turned out to speak on proposed changes to Medicaid in Kentucky. She opposes a proposed 6-month lockout period for recipients who fail to report job or salary changes.
During this time, an individual living with MS would go without recommended disease-modifying therapies.
Governor Matt Bevin wants to trim Medicaid rolls by 9,000 people, in addition to the roughly 86,000 that would be cut by a previous proposal. His chief of staff says they'll do that by helping able-bodied Medicaid recipients get jobs.
It's important that we take an approach that does not just focus on enrolling people, right, but really focuses on how do we get people better health outcomes? How do we treat them holistically to bring up their income level, their educational attainment, all those things that contribute to better health outcomes.
Amy Luttrell, CEO of Goodwill Industries of Kentucky, agrees with that goal.
We also see this waiver as something that brings new tools to help people who are not in the workforce but who could be in the workforce.
But Mark McKinley says moving people off Medicaid too soon could have the opposite effect.
I agree. We need to get people working. That should take place using the Department for Employment Services and not hold health care hostage.
Before any of these changes can take place, the federal government has to approve them. In Frankfort, Mark Vanderoff, WLKY News.